Hello, I'm Jawad Husain. I'm Medical Director at the East Lancs Hospital NHS Trust. Um, this is my COVID update, and I'll begin with mentioning the number of patients we have in our hospital. I'm going to talk about the COVID positive patients, and as of today, we have a total of 128 patients who are admitted in our hospital. These are the patients who have been diagnosed with COVID in the last 14 days. It is reassuring that the numbers are coming down because a few weeks ago, at one stage, we had more than 350 patients who were diagnosed with COVID and in our hospital. So clearly, the national lockdown and various measures are working. However, we are still not out of the woods, and that reflects in our increased critical care activity that we have been seeing since the beginning of the pandemic. As you all know, we had wave 1, then came wave 2, and wave 3 early this year. And this time, unfortunately, the number of patients who were admitted to critical care were far more sick than the previous ones. So as of again today, we have a total of 25 patients who've been diagnosed with COVID and are in intensive care. And we have a total of 10 patients who are non-COVID who are also in intensive care. Just to explain that the patients who are non-COVID doesn't necessarily mean that they are unwell with an acute sickness. They are also admitted to intensive care following major surgery, and hence that is reassuring to see that we have recommenced some of the work that was stopped in wave 1. We are undertaking all urgent, emergency and clinically urgent major surgery. So please be assured that the hospital is open for business. However, I would recommend that if patients required to attend to A&E to come through the proper channel, and that is to ring 111 or ring up their surgeries and be advised what next step they need to do. It is a safe hospital. We have taken all positive and possible measures to reduce the nosocomial spread of infection in our hospitals. Unfortunately and sadly, deaths from COVID still is occurring. In the last 7 days, we had a total of 30 patients who sadly passed away. These were the patients who were diagnosed with COVID in the last 28 days. As I'd mentioned earlier, reassuringly, national lockdown measures, vaccination is working, and that reflects in the incidence and prevalence of COVID in the communities. The figures from the communities that I have is that in Blackburn with Darwin, we have a total of 197 per 100,000 people who are diagnosed with COVID. In Burnley, it's 131, Rossendale, 115, Hindburn, 149, Pendle, 166, and Ribble Valley, 148 per 100,000. These are still high numbers, and we really need to concentrate on that national message of hands, face, and space. Unless we comply with these strict regulations, we will never achieve a very, very low number, which is essential for our moving forward in this pandemic. On a positive note, our teams have done a fantastic job in providing vaccination to a total of 16,500 people. This is a group of people who comprises of staff, vulnerable adults, care home workers, and obviously patients. We have been not only providing vaccination at our hospital hubs, which is in Blackburn and Burnley, but we have also got mass vaccination sites. Blackburn Cathedral has been in action for the last few weeks, and only this week we have also stood up a mass vaccination site in Burnley. Again, the request is that please come forward for the vaccination. Government has set out cohort of people who are eligible for vaccination, and as you would have heard on the national news, we are now offering vaccination to the group 5 and group 6 cohort. Only yesterday or the day before, government had added 1.7 million clinically vulnerable patient to the group who requires shielding. So when you get that letter, please ensure that you are shielded, but also you need to be vaccinated. Getting a vaccine doesn't give any guarantee that you are not going to be spreading the virus. So please ensure that you follow the guidance of hands, face and space. It's very important. Another success story in our conurbation has been the establishment through the partnership with our community colleagues, GP and associated agencies in setting up virtual COVID ward. This is where a patient who is, although unwell but doesn't require hospital admission, is monitored at home with appropriate backup and interventions from specialists. We have been running this since late October, and it has helped manage the patient very successfully in their home environment. Long COVID clinics are another project that has been successfully started in collaboration with partners in the community. It is a group of patients who has suffered from COVID and some side effects from it. In the coming few weeks, I will be updating you on how we are progressing with this. I hope you find this information useful, and please contact us if you wish me to include any further information that you would find useful in future communications. Thank you and stay safe.